Mani sir said that he will join today. Most probably he will be on YouTube platform.
Oh, acha. Yeah,
He
morning
sits in Gulbarga.
morning I had a chat with sir, and
Yes.
sir is in Gulbarga, I think.
Yeah, Gulbarga.
Yeah, yes, that's what. I had a chat with him morning. Yes. You were in your office, sir, or your home?
No, office only.
Office, yes.
We are regularly coming to office.
Yes, we are also, but we are bound to, because
Yes,
we are medical, so everything is open.
yes, sir.
Dr. Deepak has done a great job in our university, and specifically our university's accreditation to NAC-A by single faculty. It's only university in India which is having a single faculty become a NAC-A in the second cycle.
Yes,
So even in the NIRF also, we are now rank holder. Out of 640 medical school, we are now 50th rank holder of NIRF. I think one big credit goes to the IT, and
yes,
Dr. Deepak is one of the Dr. Deepak, and one is assistant Dr. Anil Reddy. Our IT department actually run by doctors.
Oh, that's really great.
Engineers, here engineers are not there, only they are working, but there are some good engineers he has recruited who are actually very fruitful. But chairman is Dr. Deepak and Dr. Anil Reddy assisting.
I think the guidance and support from the elders is very much important. The
that
faith
much
that they
only.
have kept. The
I do
faith,
not know computer. I'm not good in computer system and all. I take my help of either my doctoral student, postdoc student, or in home my son come to rescue me.
The university has really had faith in us, so we have just given our best to the university, sir.
You all deserved.
Dr. Pradeep Malagi has also joined.
Dr. Pradeep has joined as a tomorrow's speaker. Another very favorite of mine. He's a very good engineer. He's an engineer, right? True sense. And
Welcome, Dr. Pradeep.
Thank you, Professor Ramesh.
Dr. Pradeep is there. Dr. Pradeep, good afternoon.
Good afternoon. Good afternoon.
Yeah, just now I was telling to Dr. Ramesh that I have two love in my heart. One is from medical college, Dr. Deepak Chavan, another is from engineering college, Dr. Pradeep Malaji. Both are young and both are dynamic and extremely good. Just now I was sharing my experience, this understanding of both of you to Dr. Ramesh.
Yeah,
And
it's because of mentors like you.
And to your information, Dr. Ramesh is one of the very great scientists. He had a long-standing credibility. He is not a simple man.
Yeah.
He's very simple in his attitude and behavior. He's a role model for many one of us. Specifically, the younger generation should follow him.
Kushal Das sir is role model for us.
Yeah. For all of us.
I'm the old school. You all are younger generations.
Oh, sir, I'm also old. In another 3 years, I will be retiring.
But still, you are very young, younger than me. I am far older than all of you. But you did a great job in your own discipline and established the KSTA, your hard work. You must remember the way you have worked and given a shape and put this academy. I think this is the most vibrant science and technology academy in entire country.
Thank you, sir.
It's because of you and under the guidance of Professor Ayappan sir and all great stalwarts.
Yes, sir. Thank you very much. Shall we start now?
I think it can be started now.
And some may join little later. Yeah, we will start. Good evening, everybody. Today we have with us senior most scientist, Dr. Kushal Das sir. Welcome to you, sir. And we have with us Dr. Deepak Chavan, today's speaker, a well-known surgeon in Vijayapur. He has done his MBBS, MS, then many other fellowships, then DMAS. Now he is presently the associate professor in the Department of Surgery and also the chairman of Information Technology, which is a rare thing, doctor. Indeed, congratulations. Many doctors don't know how to operate computers. You are heading a IT cell. Great. BLDE, deemed to be University Vijayapur. In fact, I am from doctor's family. My father and my father-in-law and my brother, uncles, many of my cousins are doctors, but they are not so tech savvy like you. That's why I said congratulations.
Thank you, sir.
Achievements. Dr. Deepak has bagged gold medal in the World Laparoscopic and Robotic Surgery course, and he is also a recipient of Mother Teresa Gold Medal Award 2014 for treating and teaching poor children, and he is also a recipient of an NGO award, Sahas, awarded for remote monitoring and treating the old age patients. And his innovation and activities include software and application development for medical education. He has 2 patents in technology for teaching, and he also has built steps and technologies towards paperless campus. Really great, go green concept. In fact, in government also we are trying to make it go green, paperless, but not so fully paperless. We do use paper and virtual dissection table, learning and teaching. And he has published 2 books, Basics of Tech for a Teacher and ICT, Doc to Data, 3 books, in fact, 3 books. With this very brief introduction, Professor Deepak will be speaking on recent advances in surgery. With this brief background, I once again welcome to you, Dr. Deepak. And
Thank you,
over
sir.
to you for your distinguished talk. And
Thank you very much, sir.
I also take this opportunity to welcome Dr. Pradeep, who will be speaking tomorrow. Welcome, Dr. Pradeep, and all the participants. Thank you. Over to you, Doctor.
Thank you, sir. Thank you very much. And indeed, really, it's my pleasure. And thank you for giving me such a platform, because I always wish to encourage the juniors and the young budding students who I really want to be the best in coming days and in future. Sir, I'm having a little sore throat. If I'm a little bit in between, if I disturb, then please. And second thing is taking into consideration the audience. Today I have made slides little colorful, less of words and more of images and videos. Let's hope all will enjoy. I am associate professor in Department of Surgery and IT chairman. This is my signature slide. A knowledge of the past contributes to the present and leads to the better future. I, the surgeon, owe gratitude to the great teachers of surgery, because of whom I am here today. So the heading under which I'll be talking is in introduction, the history, how the surgery evolved, the advances in surgery using the technology, and the technology, how best it is supporting the medical background. So let's go into the introduction part. So as a youngsters, you really want to become doctors, engineers, scientists, soldiers. As many of them, they say they aspirant for civil service. And some do say that, let's see what happens in future. Let me be like that, what I really want to be during that circumstance. I want to say for them is there are 2 important things. That's ambition versus reality. A person is happiest when he chooses a job that he loves. Before making a career choice, take time to understand yourself, your likes and preferences. Ambition cannot be injected, nor it be imitated. If anybody is interested to talk regarding this, last slide I'll give you my number, and I will be ready to give you some encouragement how best you can choose what you really want to become in future. To be a surgeon, they say you should have the lady's finger, the lion's heart, and eagle's eyes. So this is what makes a surgeon a complete surgeon. But today in this technical era, even I want to add, a surgeon should know the technology. These three are very important, but the technology is the one which a surgeon must know in coming days. We have wide scope to operate on every patient, right? We can operate on GI conditions, we operate on brain, we can operate on kidney, we operate on children's. There's a plastic surgery where we do miracles. I will show you in my coming slides how best our surgery has evolved and our surgery has done the best. In the past, one student asked me, sir, how they used to suture the wounds. And this is not written anywhere. See this, a baby where the baby is having cut on the leg, and see the mother is doing a suturing, which is now we call it as the stapling device. Those days, the ants were used, and once you just see the ant is used for the approximation of the skin, and immediately once the ant bites, the neck of the ant is throttled around. But now it is the staples that we use for the papers, which are in the most sterile version, we use for the approximation of the skin. You can see this video. Yes. Now she will throttle around the neck. So this is a stapling device that we are using right now. Okay, now the sutures have gone, the staples have come into the place. They are stainless steel, very less infection when dealing with the infection point of view. In the olden days, they used to use the glue for the approximation. That's a plant tree glues. But now again, the glues are back in the market to approximate the skin margin. You can see this application of the glues that are used in approximating the skin. So there's no suture marks. So let me take back the flashback pictures. You can see here the surgeons operating with their favorite blazers on, as well as the sisters are on their favorite dresses. So this used to be the scene in 1940s. But now you see, you will not make out who is the surgeon, who is the assistant. Everything is covered because the protection has increased. The sterilization process has increased. In coming days, because of corona and any other viruses, we may get to have costumes like Spider-Man, similar to the PPE kits, but they are latex made and they are in the market. Just have to bloom the market so that it will reach each and every individual, every surgeon. Sushruta has contributed a lot to our surgery, father of plastic surgery, and father of brain surgery. So there are many Western surgeons who have contributed for this surgery development. The one wrong thing, I can say, the backstep that Indians had was there was no publication from Indian surgeons during those days. Otherwise, we would have been the first to be followed by the other Western world. So these are the great surgeons who contributed and helped the technology to reach here to the present stage. This is the Sushruta and everybody. This is for the youngsters. Those days, the central punishment was to cut the nose. And majority of the patients who used to get this punishment used to come to this surgeon to get their nose repaired. Fine. So he was the one who did the plastic surgery in the first. He was the one, that is Sushruta was the one who invented so many instruments. Now the instruments are similar, but they are refined. The size have changed. The material with which the instrument is being made are changed. Now the interesting thing, the advances in surgery, the technology supporting our surgeons. I want to show this video to the youngsters. This video is of 1999, the movie called Matrix. If you have seen this movie, see this is very much, in limelight. You can see this. You can say the villains. I'll be in very lower words. So villains putting the technology worm into the hero's stomach, right? So it has gone inside and it is going to control his body. See, it is in 1999. The thinking goes like this. So next, what happens? The friend of the hero wants to remove this without doing a surgery, right? Remember, without doing a surgery, and it was that time was many of my colleagues or many of my seniors would have laughed at this, that how is it possible that she is removing the worm or the pathology from the GI tract? She is observing. Now once that is there in the picture, with the suction and the X-ray endoscopy, she is going to eliminate this out. There is no mark, there is no surgery, and this pathology is being thrown out. So I will take you to the world like this, the tech surgery. Everybody knows about the technology. Everybody knows using the mobile gadgets. Now I will show you how we can, how the technology is supporting the surgeons in enjoying their surgery. You have a joystick, everybody might have played the games. Everybody might have played the games in your mobiles also. So with the joystick feel and seeing in the bigger screen, we can do an endoscopy, we do a robotic surgery, and we do laparoscopic surgery. I'll show you how exactly how we do it. Now coming down to this picture, you just see this image where like a joystick, the surgeons are holding the sticks in their hand. We call it as instruments, the lap instruments. There's a camera inside. You can see there is an image which is 40 times more than the normal image. That means you cutting a precise area so that you are not damaging the other areas in fact. And you can see all the surgeons are wearing the goggles. This is the technology. The laparoscopy was old. Now it is the 3D laparoscopy where the image is 3D. It appears as if it is in front of you and the image quality is 4G. This is a robotic chamber where the surgeons sit in the console and the robot operates. See, don't go by this means the robotic surgery means the robot will operate. No, the command is given by the surgeon. Then only the robot will move their limbs and does the surgery. I will show you in the videos. Next, in this laparoscopy and robotic, the incisions were hardly of 0.5 centimeter to 1 centimeter. But the people, even some of the celebrities, didn't accept that. Now the invention went ahead and they invented this procedure called NOTES. That is the natural orifice endoscopic surgeries, where either from the oral cavity or from the rectal or through transvaginal, the camera goes inside and you do the operations. I will show you in the videos right now. This is a laparoscopy where you can see the instruments are being juggled and see the size of the instrument. They are hardly 0.3 mm to 0.5 centimeters. So these instruments are used to tackle the such big pathology. This is a gallbladder surgery that is taking place in this. I will not go much in detail of these surgeries, but you just see how beautiful and how big the structure looks. Next, coming down to the robotic surgery, this is very interesting. See now, you are sitting first, you are very comfortable. You are using only your 4 fingers. And see, whatever maneuver you do here, command you give to the robot is suturing above. It is suturing the skin, the same thing it does inside the abdomen, it does all the surgery. And this is the robotic limbs that they will attach, and they replace it, they sterilize. And the best part of this surgery is, think that Dr. Deepak in Vijayapur is operating on robot, and suddenly he will not understand what to do the next step, because it generally happens in big tumors. So that time I can call my friend and I can say, see, I have stuck up in surgery, please take over my surgery. So he can just join into his consult and he can operate on my patient who is in Vijayapur. Fine. So here I'm showing you, you can see here, this is one surgeon who is operating, think that he's stuck with the surgery. Now the second surgeon who is there in Bangalore or in Delhi, he takes over my surgery. He need not to come to Bijapur to operate this patient again. And it is through the internet, lease line, fiber optics that is connected. And he's operating. You can see this. Now when he's starting operating, you will get it. So this is the beauty of the robotic surgery. This is a live. This is the sorry. I meant to say the surgery. You can see the internal suturing of the pathological sections. Okay, let's go. What is the beauty of this robotic surgery? See, they said when I joined surgery, they said the surgeons once they become old, they can't operate. But no, it's not true. Even though a surgeon who is having the fine tremors or the crude tremors in the hand, they can operate using the robots because the robots eliminates the tremors. And the second thing, the surgeons stand and operate where it avoids here the surgeon can sit and operate on the patient. Excuse me. So these are my clips where I went to learn about the robotic surgery. The best part of when I was going through the robotic training, my trainer told me that it is a costly procedure. You have to keep on changing the limbs for every patient. Then I said, you can sterilize it. Why you need to change it for every patient? Because India is not that, the patient are not that affordable. Then he said, no, once the machine gets off, we have to replace it. And again, we have to on the machine. Then I said him, why you have to replace it? Why you have to switch off the machine? Don't switch off the machine. I said, and they tried this for 2 days and they found that without offing the machine, it never asked for the new limb, I mean to say the new instrument to be replaced. Because in the Western world, these are all disposable limbs. But in India, we can sterilize and we can reuse it. And that has been also published in the literature. Now notes that I said you natural orifice. Here there's no scar at all on the, in your abdomen or anywhere. Here we use the natural orifice. I'll just show you how this insertion takes place. These are all the instrument that is being used for notes. So here the patients, we are using transvaginal route. How we enter this transvaginal route using a camera, and later on the process of surgery takes place. I'm just showing you one clip of it. So this is the intra-abdominal view. So this what you're seeing is a uterus, and below the uterus, there through vagina, there is insertion of the camera takes place. And once the camera is in, the other ports are placed and the surgery is carried out. Most of the celebrities who don't like to have any scar on their abs will undergo surgery through this procedure called notes. Now, the cyber knife radiation, the best invention that you see here right now, especially in case of brain tumors and pancreatic malignancies. This gadget, I can say this radiation machine is filled with the MRI scan of the patient, and patient is made to sleep. It radiates the gamma, and because of this constant radiation, the tumor cells become less, and they get destroyed completely. without any invasion, without any surgery. So the refinement has taken place. Initially, it was started almost 9 to 10 years back, but now it has become, the cream. And in another 2-3 years, it's going to take over the cancer field. Now, laser surgery. Initially, the laser surgery was mainly reserved for the skin conditions, but now with the laser, you can do almost all the surgeries like piles, fissure, hemorrhoids, varicose veins, cosmetic and gynecological surgeries. You can do some of the pain that we generally have plantaris. So the benefit of these surgeries are they are mainly the daycare procedures. They are minimally invasive. There is very less blood loss and high success rate and fast recovery. So these are my pictures of while I'm going doing the laser surgeries. Now going to the technology part. How best the technology and what is the technology doing in our field now? If everybody thinks that these are invented by doctors or something, nothing like that. It is not invented by doctors. It is a group efforts of everyone. Here the engineer is involved, here the scientists are involved, here the doctors are involved, the designer is involved, the marketing guy is involved, and the approval team is involved. So I was into testing team. Thus, these group of you can say the inventors used to give me a device and I used to apply it on the patient. I used to give them the feedback. No, this is, I need changes. Then it is to go to the designer or it is to go to the software guy who's to do the changes and he is to put it back to me to test on the patient and see how best it is helping the doctors and the patient for the better treatment. Now technology and all the students are here. So future is here in your watch. So future, the watch may be gifted or may be given by your schools. What for? One, the watch will take your attendance. The second, the watch can track your heart monitor. The very important thing, you cannot lie in schools from coming days because if you lie, the watch will say that you are lying based on your arrhythmic conditions as well as your heart rate. It monitors your heart rate. So if you are wrong, it will say you are wrong, right? So you don't have any other choice other than saying truth. So this technology of watch it's so fastly advancing, especially for the heart monitoring as well as for the workout and diet. The patients who underwent some heart surgery or who are having some heart diseases, when they wear this watch, they have the constant monitoring of the heart. If at all, if some changes do take place in their heart rhythm, the message is triggered or alarm is triggered to the concerned doctor as well as to the patient so that he can immediately go to the doctor and take the treatment. This is an interesting thing. This is capsule endoscopy. How small the cameras have become today. In a capsule, a small capsule, it is of size of your same capsule, the tablet, what you call for your level, it's a capsule. And you can see here, there are cameras are fitted inside. For some of the smallest to smallest diseases which are not seen through other scans, you allow the patient to swallow these capsules and this capsule enters into the gut, into the intestine, and it will give you so beautiful images and it will tell you where is the pathology or diseases and what you can do to those diseases to treat the patient. This is how it is. So this is a capsule endoscopy which is going inside and you can see this is having given the track. It takes the image 360 degrees and this image initially it is to come out and then they used to process the image, but now it is on track, on par. Now it has gone to such a level that anytime the surgeon or the endoscopist can see the images even though the capsule is within the gut of the patient. Now, heart rate monitoring. Initially, we have seen that some people have stopped going to gym or anything like that because of some of the heart cardiac conditions where they are not supposed to do. For them, this is the best option. You know, the bunions, the innerways, what we call it as, they are having the sensors now. Okay, and they'll be in the market within a year. So these sensors will check the heart, will check the muscle tone, will check even the pain, where are the areas where he's getting the pain. And this is recorded in the digital, in the mobile, as well as it goes to your doctor, and even it will go to the physicist or the physiotherapist who is training you for your health concerns. And these things can prevent the death which can be prevented, right? Now, Bluetooth stethoscope. You can see the stethoscope here where the patient is holding the stethoscope. The doctor is hearing as well as recording his heart sounds. And this heart sound, he can send it to the other doctors also. And this was a very good, we have contributed, we have done the innovations in this and helped us in Corona times where the doctor is kept away, where we keep ourselves away from the patients. Now, this video has been watched by everybody. It is going to enter the market, and we didn't know the corona. After corona, we came to know how many people have become technologically oriented, and one way is thanks to corona that everybody is now technology oriented. You just see this video. A patient goes into attack, and it is possible within 2 years from now, as the Google Maps are now having in millimeters updates. The drone carrying yes, the monitoring as well as the commands are given from the place where the doctor is sitting from. So it is not only the doctor, it is the technology which is reaching the people. And it has to reach as fast as possible because of the traffic population and other things. The treatment from the doctor will not reach in time to the public. So there are the other platforms which I'm not going to deal much. There are AR, artificial intelligence, and 3D. I will show you how the 3D has helped doctors and in data keeping of the patients. See, this is a 3D of a gentleman who had a swelling in the back, which was removed, and you can see this the second picture where there's a scar mark. See, initially it used to happen that the data of the patient is not stored at all. So what used to happen after 5 years when he comes back, when we don't know what has happened and which surgery he has undergone. So these data, storage has helped us to bring back the pictures of the past surgeries that he has undergone. And these images also we forward it to the pathologists, which will help them for the diagnosis. So this is the pathological picture of this patient. I will not tell you the disease, all this, because you are in that elemental stage. So you can see these are all the other patients. Sorry. Okay. So you can see these are the other patients who has been undergone the 3D scanning. And the real value of the 3D comes when you capture the texture as well as the pathology in it. Not only just a black and white image, which we used to do it in past. Artificial intelligence is really now, the backbone, you can say. In future, it is going to really make a big change in the field of medicine. Like example, I will give you that tomorrow, whenever in the CT scan, whenever the patient image, whenever the patient undergoes the scanning, the diagnosis will immediately come out. So, because of repeated training of this softwares, the diagnosis is immediate. Even when you put a slide for the diagnosis of a patient's pathology, these artificial intelligence are going to give you the best results, not only in case of the treatment portion, as well as for prevention of the diseases. Even the retinal examinations will prevent the future upcoming diabetes and the complications. So it has got a vast role to play in coming this thing. So there is a collaboration between the doctors and engineers to develop such softwares in each and every field of medicine. So what docs can do? Everybody, asks what docs you are so much interested in technology. Yes, not only me, we are the doctors of coming generation are also interested in technology. He's my colleague. You can see him. He has opened the system and he is giving. And at a time, he is operating on 7-8 systems. And now he is developing the artificial intelligence in our university. So he is a student, he is a medical student who is fixing the lens. So he knows what the lens, what type of lens he requires, what type of current the lens requires. So all these things he knows better than the service provider. So today is an era where the service provider or the engineers or you can say the marketing people are going to take input from the doctors, what they really need and what they really require. So the data entering of each and every patient is happening into the system so that even if the patient need not to come with any papers and pen in the future coming, we can see what all the treatment he has undergone previously and what were the drug allergies that he had. With the technological support, we can really make a lot of difference. This is me, I dream of technology and I sleep with technology. Innovations, initiations, and research. Our field is open for everybody. Medical field is open, and you can give your startups in our medical field. The best part, what has given us in this, the technologies helped us is in the research. Initially, it used to happen that I have to go through 100 to 1,000 files to come out with one, conclusion for one study. Now, when you have got a technology platform, I have to just enter everything in that, database, and I can get immediately. For example, anemia patient. So I come to know how many patients anemia patient had come to my hospital, how many were males, how many were females, how many treated with injections, how many were treated with blood transfusion. So every data is available whenever you need it. I need not to search his hard copy, check, and everything. See, there's a time consuming. So these are all the things that are there. So I'll just rush to my slides. What are the take-home message that I really want to give you is update. Update yourself from blackboard to motherboard. You have to update yourself, right? For every stage, you update yourself. And what I was, yes, I was a tech savvy person from before in during my MBBS. I used to do everything smartly. Whenever there are classes are there, I used to record in that small MP3 player which used to come. And later I used to listen to those only, and I knew what are the questions will be asked whenever there is a case presentation. So I used to answer them immediately. So everybody used to tell, "Oh, boy, you are not, bookworm and you are good at case presentation, other things." Only the smart handling of the technology I did. And today I think so with the support of university and management, I'm heading the IT team here. So always try to look into the technology aspect because now it's technology driven. So you press like or dislike, but if you press like, then you will really, I'll tell you, you'll bounce high. But if you press dislike, you may be rejected in coming future. I'm talking about the coming future, right? And I love to store everything in a soft background. I hate papers, using papers. And my dream is to see the paperless campus, the paperless governance, and paperless central government also in coming future. So I love to store the data in the soft copies rather than hard copies. So I welcome you all to my BLD University, and we call it as BLD family. And you can call me to my number from 8 p.m. to 10 p.m. You're most welcome, and your ideas, initiations, if you have got any hindrance, you can call me and discuss with me. And with this small note, I'm going to end my speech because I love to interact with the students if they are very much interested to do so. Thank you, sir. Thank you very much.
Doctor, thank you very much. Indeed, it was a very informative and scholarly talk, and you took us through the entire surgery from the past to the present and how technology is helping today. Great. You are a great speaker, and I loved listening to you. Thank you very much, Doctor. Now,
Thank you, sir.
Kushal Doctor is there with us. Sir, over to you for your
Yes. Yeah. First of all, I like to convey my sincere thanks to KSTA to organize this type of program. And I think that this is actually eye-opening for many of the scientists in my age groups, in all the disciplines I'm speaking about, not only the medicine, but also any disciplines in this earth it belongs to, including any human being. They must know it, that where they can get the support. So Dr. Deepak, whom I know personally as my colleague, junior, like my student, and he is definitely has touched the heart of everybody who is listening, who has listened, and who is going to listen. That is also because as it is it is stored in the YouTube. It is entered the background what is said to start the surgery. He started with the father of surgery, that is Sushruta. So our Rishi Sushruta towards now, how the technology has actually evolved. And he specifically rightly pointed out the history, how Indians actually did not keep, reserve, or store the many information what Sushruta did it exactly the way, or the instrument and devices by which Sushruta did it, many of the things are missing. So there's a big gap in India. This is unfortunate. This is there because my own experience I have seen in Italy when I visited the University of Rome, and there is a Museo Galileo. So Museo Galileo is now actually, earlier its name was the History of the Natural Sciences in the World. So they kept the everything throughout the world, for surgeon to medicine to obstetrics and gynecology to any discipline of the science, where even Galileo's own periscope and this scope, bioscope and all periscopes, everything is there, and which telescope, sorry, which he has kept, he has first invented when he was in in Venice, and that is also still preserved. I have found in my surprise in that museum where Claudius Galen, the father of surgeon in the Western medicine, he was working in the Rome, and not working, he was actually being captured in a condition when he was a Greece, specifically Greek. But Roman, when invaded Greek and destroyed the Greek, they had only one condition, that we can save your life if you give us the Galen, who was a renowned surgeon and professor. So if he comes to Rome, we will excuse you and will not at all take. And that's the condition. Roman emperor actually took the Galen, and Galen was actually did a massive surgical work for gladiators who were being actually killed, or they killed others injured. He sutured And for this, he has invented the bent needle, which is commonly used by surgeons nowadays, and the suturing needle. These two original invention in nearly 2000 years back by Claudius Galen, still University of Florence in Italy kept it, preserved it with a multiple model and devices. So we miss our history, I think. Now the artificial intelligence, or you can say the computerization, all will definitely make such type of history to preserve what is going to do it. Dr. Deepak has rightly pointed out that, and he explained correctly the how the evolution, it is an evolution of the surgery, has come to an artificial intelligence via robotic surgery, 3D surgery, everything, now to artificial intelligence where the human brain will be differentially expressed and all, and where brain will work faster than the fingers of the surgeon. And that's the thing I think he wanted to hit, and he correctly hit it. This is an amazing talk. I actually thought that if I would have listened to him for another 10 more minutes, I would have been more happy, because it was so informative and new, even though I'm from the medical background. But I enjoyed it in that way. But I have only one question to Dr. Deepak, which I feel I must ask him, that when you do the robotic surgery or any of the surgery using the artificial intelligence, as a surgeon, as a medical doctor, you know the medical ethics, how you will actually overcome the ethical issues in this aspect. When a surgeon is a remote and the patient is inside, who is actually taken his consent of operation under you and your hospital? You have taken an intelligence support from a distance mode. Now, how ethical things will be handled? And do you think that ethical things should be addressed properly by medical ethics nowadays? Thank you.
Sir, wonderful, wonderful question, sir. This is, sir. Let's coming down to initially what I showed you about the 3D as well as the MRI and other things. Now, the planning for the surgery has gone to such a level that you before only now the MRI and CT are going to give me such a nice, beautiful pictures, 3D images, that I know what surgery I can do and how best I can go, where all I can cut and which all the part I can handle on. For example, if I'm tackling with the stomach and I need a super specialized surgeon who is very well versed with the pancreas and the pathologies involving both stomach as well as the pancreas, in such condition, the patient counseling, those days have gone where initially we used to tell them to sign for surgery, nothing. Now we will tell them what surgery they are undergoing. See the 3D images you might have seen, sir. I have shown you the swellings and other things.
Yes.
In fact, we do surgery, we just mark the surgery incisions. We show them that this is the surgery incision, this is the pathology. We enter into the 3D world, we enter into the augmented reality world, and we show them that these are the structures to be removed. And secondly, taking over of the surgeon, in fact, we tell them, we take the consent that other person is visualizing the surgery. First is visualization. Without the consent, I can't say that I'm transferring your images there. The first is visualization. Second is the operation. I can say that the surgeon's help is required at this stage. He will be operating on this robotic part and he will take over your surgery part. Then the majority of the patients are convinced and they are happy also because 2-3 surgeons are operating and the specialist to specialist are into killing my pathology. So they accept it. I have not seen a patient who have neglected or who has said no to it. The difficulty that we get is only the fiber optic lines, where majority of times we have seen that there is disconnection takes place. But it used to happen 5 years back, but now there is no such thing. There's a lag of hardly, I can say milliseconds, which can be tackled around and nothing to define. So only thing we have to explain the patient well before the surgery and their consent is required. One, we call it as visual transfers consent. The second is the operational consent. So both consent we take from themselves in robotic surgeries.
Right. So it means there is no ethical issues actually coming across while doing the surgery. Absolutely, it is clear. So there is no need of any modification or a change or any of the information as you suggested and you said it, right?
Yes, sir. No need of those this thing, which ethically it is they have validated. And the main aim was in the beginning of making this robotic was the first thing. I was also surprised. They wanted the 2, 3 doctors to operate on one patient. And even I was surprised. Then I said, okay, good. So that technology is behind this.
Right. And second point, just I like to ask you, what about the financial commitments? How do you think about the robotic surgery? Will it be a financial supported by to the poor people or the downtrodden people of our country? How it will be addressed? Such an advancement technology of the surgery.
Yes. Sir, the first thing, the robotic surgery, the cost is high because they used to change the every single hand, and the hand we call it instruments. So they are supposed to change it. They used to be disposable ones, which till 2 years back it was under the Western world because they wanted to sell this product. And every one surgery, the next surgery, I'm supposed to change the limb. And what used to happen in robotic surgery is, and whenever you want to change the limbs of the surgery, I need to switch off the machine. And once I switch off the machine, the center, the robotic machine vendor center, I'm very in very simplified way. They used to come to know that, okay, one surgery is done. Now they're shifting to the second surgery. So when you go to second surgery, again, the limbs, new limbs has to come, and the patient was paying for the limbs, not for the surgery. So what I suggested there when I was in the training, why you want to off the machine? You don't off the machine because there is no signal will not go to them. So you just keep on the machine on and operate 3, 4 patients with the same limb, sterilize it in ETOs. And once it is sterilized, you can reuse it. And initially, they also felt that shall we do it, not do it? This is called Indian jugaad, obviously, for our patients. So, but we did it and it was successful. And our chief was wanted to even present it in the Indian conference. They presented it also, and it worked out cheaper. And once the patent company has opened up in the market, now the robotic surgery is open now, and the machines are not that costly as it used to be before. Now every company has entered into the robotic field. Now it will reach I can say every district, because when I had gone for training, it was there in Delhi. Now it is there in Mumbai, Bangalore, everywhere it is there. Now it will reach district wise. And now the company also wants to set up their units because they have production, more production, less owners. So they want to set up, and it is going to reach the people. And many I have seen who undergo these surgeries are who are insured people, who have taken insurances.
Yes.
So
Yes.
in coming days, sir, it is going to reduce. As initially laser was so costly, now it has really dropped down. The cost of the laser machine has dropped down. Initially it was to be 40 lakhs. Now it has come down to 15 lakhs. So you can see the difference within 6 months. Within 6 years. So it is like change in technology, and every how the mobile is changing every 6 months. So the change in technology is definitely will make us that it will be within another short time. It will be available for the people of needy people, sir.
Thank you, Dr. Deepak. Over to Professor Dr. Ramesh, sir.
Thank you very much, Dr. Deepak. One question. Since 1990s, we have been talking about telemedicine because many super specialists won't be there in villages. Now, how far it has come to telemedicine has come to help the village, rather rural patients.
Sir, now I think so. BLD University has got telemedicine in Ukli and other rural areas. It has really taken a good leap, sir, because everybody is having a mobile now. Initially, those days when people didn't had mobile, that was a challenging days. But now everybody has a mobile, even though they don't know plus minus, but they know how to dial and they don't know how to talk and WhatsApp. Everybody knows, even though educated, uneducated, they know to push your records in the WhatsApp, and they know how to talk to you, how to interact with you. So the technology has gone to other leaps, because I'll tell you, last COVID, I think so 780 patients I've consulted over the phone. Until today, I tell them not to come to the hospital because I consult them over the phone, and most of them are villagers. and they can't spell the medicine name. So I tell them, click the photo and send it. So they click the photo and they send it. And I just mark them square. I tell them, don't take this, you take this. So, our skills have also improved. I can say thanks to the corona or anything. But skills have improved, and we know also the patient's this thing. But telemedicine has gone to different levels, sir, if the money is not involved. But yes, some of the apps or some of the other telemedicine things, they just charge the patient and then they let you enter. For technologically oriented people and for tech savvy and for affordable patient, it's fine. But non-affordable patient, I think so, the WhatsApp, Telegram, as well as the normal video calls. Nowadays, they started calling from the Google also. So I'm happy that they're using these basics tools to reach us, and they are very much open, and they know the rings and fancies how to touch me, sir.
Excellent, doctor. It was a very, very thought-provoking and very informative, scholarly, scholastic. Excellent. Thank you very much for your time. In spite of your busy schedule, you accepted our invitation, delivered this wonderful talk. Grateful to you, doctor. As of now, there are no questions. If students are a little bit shy because they are few students, if they send any email, we'll be forwarding it to you for your response later. Thank you very much.
Definitely,
And
sir.
I'm also thankful to Professor Das sir for suggesting you. And sir, KCM will be organizing many talks like this. Please suggest many more young surgeons, young engineers like Dr. Deepak. We'll be happy to host and organize the talks in future as well. I also thank all the participants. Thank you very much, Doctor.
Thank you, sir. Thank you very much, sir.
Thank you very much. Thank you very much.
Thank you very much.
Thank you, Dr. Ram.
Thank you, sir. Thank you very much, sir.